Never text me this weekend.
I spoke with him yesterday.
What?
I spoke with him yesterday.
Okay.
Yeah, says he's feeling much better.
That's good.
Mhm.
Yeah, no, I was so shut down on work and it was not functional. Yeah.
Good morning, everyone. How's everyone doing on this rainy Monday? I hope well. It's nice to see everyone this morning. We will get started with our JF meeting. I don't have remarks now, but I will reserve the right to have remarks at the end of today's meeting, just in fair warning to members and those listening in. But with that, I'll turn it over to Senator Anwar.
Same remarks. Thank you, Madam Chair. Thank you for all you do.
Thank you, Representative Clara DeStitria.
Ditto, ditto. Let's go.
Thank you. And I will say what I always say, our leaders, fellow leaders, including Senator Summers and other members of the committee are often juggling multiple committees. And so with that, we will move forward with bills for review. The first item on today's agenda is Senate Bill number 194. This is an act concerning cardiac screening and sudden cardiac arrest prevention for certain student athletes. This is a JFS to the floor, LCO 3512. May I have a motion? Moved by Representative Clara DeStitria and seconded by Senator Anwar. And I'd like to thank both Senator Anwar and Rep. Clara DeStitria for their advocacy on this bill for our student athletes. And this bill will require our high school students who are participating in sports to have an annual athletics health assessment, which would include a physical exam, screening for serious cardiac conditions. The form would need to include a checkbox that has family history of sudden cardiac death, screening questions for family members, and a checkbox to indicate whether the provider conducted an EKG. It does extend these health assessments to several provisions that apply to standard student health assessments. There is S language, and I will point out that this bill remains a work in progress for us. We anticipate in conversations that a few other changes may need to be made. But the bill today that's before us, the original bill would have required a cardiac-related screening for student athletes only in high-intensity endurance or power sports, and this S language includes all student athletes, and required if they reported certain cardiac symptoms, they take an EKG and get medical clearance, and this expands that. Is there discussion or questions on this item? Representative Clara DeStitria.
Thank you, Madam Chair. This bill still needs some work to make some changes, and I think the goal is our student athletes currently have to get a physical that lasts for 16 months. We just want to make sure that the healthcare provider, the student athlete, and their parent or guardian has the appropriate conversations about cardiac health. And if they determine amongst themselves that further screening is necessary, then we want to make sure that that does happen. So I'm hoping I will support this today, and hopefully we'll make those changes moving forward. Thank you, Madam Chair.
Thank you very much, Representative. And again, thank you for your efforts in communicating both with the Heart Association and our athletic organizations. Further questions, comments on the bill? If not, if I could ask this today, thank you. We have with us Mr. Administrator, if you could kindly call the roll.
This is a roll call vote on Senate Bill 194 to be JFS to the floor, LCO number 53512. Senator Anwar.
Senator Anwar votes yes.
Representative McCarthy-Vahey.
McCarthy-Vahey votes yes.
Representative Belton.
Belton votes yes.
Senator Marks. Senator McCrory. Senator Summers. Representative Clara DeStitria.
Representative Clara DeStitria votes yes.
Representative Berger Javallo.
Berger Javallo votes yes.
Representative Biggins.
Biggins votes yes.
Representative Carpino. Representative Delphinius.
Rep. Dauphiné votes yes.
Representative D'Amico. Representative Elliott, Representative Ganga,
Yes.
Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Gordon,
Yes.
Senator Hockaday, Representative Cavros DeGraw,
Gavros DeGraw votes yes.
Representative Kite,
Representative Kitt votes yes.
Representative Kennedy,
Kennedy votes yes.
Senator Kushner, Representative Mara,
Mara votes yes.
Representative Martinez, Representative Morambello, Representative Parker, Representative Paletta,
Yes.
Senator Rahman, Representative Reddington Hughes, Representative Romano,
Yes.
Senator Slapp, Representative Steinberg,
Yes.
Representative Zupkis. Is there anyone's names I have not called or anyone who has recently entered the room? Senator Kushner votes yes. That is the roll, Madam Chair. Representative D'Amico?
Pass.
Thank you. We are on item number 1, and Mr. Administrator, thank you very much. We will hold votes open today, I believe, until 4:30, if that's okay with the team. Great. So the votes will be held open today until 4:30 on Zoom or upstairs in the public health area. Moving on, we are moving to item number 2. Senate Bill number 451, this is an act establishing an advisory council on CAR T-cell therapy and other gene therapies. This is a JF to the floor. May I have a motion? Moved by Senator Anwar. Is there a second?
Second.
Seconded by Representative Belton. This bill will establish an advisory council for the Department of Public Health, and this is for CAR T therapy and other gene therapies. And this group will make recommendations to the Department of Public Health related to these therapies, delivering them in a safe and equitable manner, developing referral and management protocols, and advanced training for any practitioners or clinical providers who offer them. It does authorize the council to apply for and accept grants and enter into contracts or agreements if distributing these funds. It also requires an annual report to both this committee and the Insurance Committee related to activities, research findings, and potential funding. And are there questions on this bill? Senator Gordon.
Thank you, Madam Chairwoman. I know quite a bit about CAR T because I refer lots of patients to it, being a cancer doctor and hematologist. And even with that said, to be honest, I don't see that what this bill actually serves in the real world. And I'm going to highlight some things about that because I don't think this is really a role for government. When there's already a number of things overseeing this. Nothing against the proponents of the bill. I understand where this is coming from. I just don't see what it's going to achieve when there's already things in place. For FDA-approved CAR T and anything future the FDA approves, there's already lots of things that go into an FDA approval. So, for example, it talks about safe delivery of such therapies. That's already done. And not only does that have to be done at the hospitals that do this, but then they get accredited. And that's national accreditation. Where for cancer programs, there's a separate accreditation. It's very thorough, very detailed, and safety looks into that. So quite frankly, if a national accreditation body accredits a cancer center, including those that give CAR T or gene therapies, then there's nothing additional really the state would do other than you're following just general DPH codes and regulations. With regards to advanced training, I'm not certain what it is that this advisory council's going to do. There's already training. Hem/onc doctors are trained. And those at the big centers where these therapies are done, they're not done in the community, they're done at big centers. Already, CAR T's done at the big centers all around the country. Those folks already know what to do. They don't need to go for anything additional for the state. They already meet the certifications that are required, including when the programs get accredited. So I think looking at advanced training for people who provide such therapies, that's redundant on the part of the state. And I don't think there's anything the state would come up with that already isn't actually in place, especially given the various warnings that have come out about CAR T therapy, which are well known and not new, including when they were in trials, they were very well known. And all the different big hospitals participated in all these different trials and still do, including the people who provide it. Also, I'm concerned when we want an advisory council look at long-term follow-up and vector safety. That's already being done. That's all part of established medical protocols decided by the people, especially nationally, who do this. So I don't think there's anything additional the state can come up with. In addition, education for clinicians, really the people who make the referrals tend to be hem/onc doctors for CAR T. And hem/onc doctors already well know about this because it's been around for quite some time. I even had many patients in the clinical trials before the FDA gave its very first approval. So hem/onc doctors do understand about the referrals, and it's something that we do look at and also know a lot of the eligibility and non-eligibility criteria of these types of therapies, which are pretty much established and uniform, not just actually in this country, but international. By professional societies that know a lot more than the state of Connecticut DPH would. I'm also concerned when we talk about development of referral and management protocols, those are already established. I can tell you that as a fact, practicing in 2 states, they're pretty much the referrals, the places that do these, who you get in contact with, are very much known. It may be people who are not taking care of these types of patients who need CAR T may not know, but they're not going to be the referrals anyway, the referrers. I'm also concerned about when we're going to look into the development of centers of excellence. There's no need to do that. The big centers do these, and community hospitals don't because it's not set up logistically. And the big hospitals also have ICU protocols for when these people get ill, and they can potentially get very ill. And that's well known and well vetted out, including international studies. I can go on and on, including about a lot of different things that this advisory council is going to be charged with, and nothing against the intent, but it seems extremely duplicative of what's already established, not just in Connecticut, but around the country, very much so. And I can tell you, when I refer my own patients for CAR T, there's quite a lengthy checklist. There's a lot of different other specialists that might have to weigh in, like heart doctors, lung doctors, sometimes infectious disease doctors. There's automatic social work, psychosocial, financial gets looked into, and a whole checklist of eligibility. Again, most of us who make referrals know these eligibility criteria and know where to send them because not every place does it, but here in Connecticut we have places that do and have very well established programs. So again, nothing against the intent. It just seems to me this isn't a role for government specifically to have an advisory council on this, when already we should be very thankful these things are established. It's separate to want to look at globally where we are with insurance coverage and things like that, but that gets into many other types of therapies, just not CAR T, which is a bigger issue. It can be specific for CAR T sometimes, and I can speak from experience where I've had some insurance companies limit what can be done, but that's a global issue, just not for CAR T. So I'm just not certain why we would focus on an advisory council for this when nearly everything is already established by the experts in the field as is. And kudos to them. They've taken a lot of time over years in clinical trials, the big professional organizations, including the international ones, because this type of stuff is done around the world, and there's been a lot of collaboration internationally to help develop CAR-T, and especially various gene therapies, including some of the leaders up in Seattle, who are major leaders, including at Fred Hutchinson Cancer Center on looking at gene therapy for sickle cell and other things, and very, very interesting what they have already in place, and that's already vetted internationally. One of the questions I have, and I have a concern, is where there's a provision in here that says that the council can apply for and accept grants, gifts, sponsorships, and donations. What are the checks and balances in place regarding conflicts of interest? So if someone wants to donate, let's say it's a company that deals with CAR-T, and they want to donate to the advisory council, what checks and balances are in place for conflicts of interest? Perhaps I missed it in the wording of the bill.
Thank you, Senator Gordon. My understanding is this language is in line with language that we have in some of our other statutes, for example, with our Rare Disease Advisory Council and others, but there's nothing explicit and specific in here that addresses that. There certainly are ethical issues that need to be addressed and may be addressed elsewhere in statute, but the language in this bill does not have anything specific related to that. And there may be more information that I can obtain related to that I don't have today.
Thank you. I think it's a pending question then, because it does raise a concern about potential conflicts of interest. We should be extremely careful of that when we talk about accepting money from outside sources. I'm not saying anything bad about wanting to apply for potential grants. I just worry about conflicts of interest. So even though I support CAR-T and gene therapy, I certainly do as a hem-onc doctor. I lose track of how many patients I've referred over the years, including for clinical trials that are still ongoing. And there are huge ones internationally that the U.S. participates in, fortunately. I just don't see that this has a need, given what's already well established. Just not in this state, but in other states. So for that reason, I'm going to vote no. Has nothing to do against CAR-T or gene therapy. I certainly support it. I just think these are situations left for those medical professionals who know what they're doing, already have things established. Let them continue to do it. It's vetted out internationally and basically by the accreditation national organizations. And I think the state DPH has a lot on its plate, and this is not something we should add to it. Thank you.
Thank you, Senator Gordon. Senator Anwar.
Thank you, Madam Co-Chair. Madam Co-Chair, I just wanted to share a couple of things with you. So this bill comes to us as part of the CAR-T vision, and this is endorsed by the Association of American Cancer Institutes, the Association of Cancer Care Centers, Bart's Cancer Institute, Cancer Care, Cancer Support Community, Catapult, which is a cell and gene therapy group, Foundation for the Accreditation of Cellular Therapy, Leukemia and Lymphoma Society, International Myeloma Foundation, and the Lymphoma Coalition. So it's not coming from one group, it's coming from multiple groups. This is not an FDA. This is actually, FDA is doing the work. This is a new era for treatment. And then while there is a cancer component to it, but if you look at the various things that are happening, and if one is to interact with our RDAC community, we are looking at gene therapy for Parkinson's disease, gene therapy for ALS. These are undergoing trials. Duchenne muscular dystrophy, there's actually a limited and conditional FDA approval for that already. So these are non-hematologic, non-cancerous illnesses. Lupus study, myasthenia gravis, type 1 diabetes, multiple sclerosis, and so on. So I think while it's reasonable to recognize that we are already there, we have arrived, but the reality is if you look at the total number of even sickle cell patients in the state of Connecticut, and which is an orphan disease which can be cured, despite the FDA approval, despite all of the technology, despite having the cure for it, does everybody with sickle cell in the state of Connecticut has the opportunity to get the treatment? The answer is no. And that's just one example. So I've talked about so many other illnesses. So this is a new era. We can have two approaches. One is we say we have arrived and that's the end of science and technology and we'll not go further. Or we say that, look, this is going to be a new era where there's going to be illnesses that were universally fatal or debilitating for individuals, and we will have an opportunity now to provide care. Even when the FDA approves them, we may be able to be fortunate to make sure that the citizens in the state of Connecticut would be able to get this. In order for a person to get this treatment, it will take a village to be able to help out. There will be long-term implications for the person, the cost-related issues, the complexity of the care, and therefore it's worthy to make sure that village and the support system for that patient is going to be there. It's not that FDA-approved check and everybody will do their share. It is going to require a lot of burden on the part of the families and support system. So I think that's where the conversation needs to be, and that's why all of these organizations and the ever-growing number of organizations are asking for the states to be ahead of the curve. I was fortunate to say that our state for the sickle cell was able to apply for a grant from the federal government. It was because of the efforts that we were one of the few states that was able to do it. There are similar federal grants. If there are coordinated efforts, we would be able to get that funding that will come to the state of Connecticut and allow our patients to get the treatment. So I respect my colleague's views, and of course, he's far more experienced on the cancer aspects, and I'm not going to question that, but this is actually not FDA approval process. This is not scientific approval questioning. It is about what can we do for the people in the state of Connecticut to get the treatment and create that environment for making sure that we benefit and our patients benefit from this treatment. So, Madam Chair, I'll be a yes on this vote. Thank you. Back to you.
Thank you, Senator Anwar. Further questions or discussions? Senator Gordon for the second time.
Thank you, Madam Chairwoman. I appreciate the remarks of my colleague, and I specifically talked more than just FDA approval. If you look at the wording of this, it really gets into what people who already know how to do this are doing in setting up the protocols. If we just want to focus on trying to get grants and looking into access issues, and especially insurance coverage issues, I think then we can really do that. But we shouldn't necessarily get into a lot of the other stuff that's in the wording that really is the domain of those in the hospitals who are doing this. So that's my concern, that this advisory council, I think, is going to be stepping into something that it really shouldn't be stepping into, and I think it can really have more impact if it focuses on a couple of key aspects. For it. But again, I talked more than just an FDA approval, and that's why I highlighted the fact that the hospitals that do these things already know how to do it. CAR-T is not new, actually. It's been around for quite some time, especially in clinical trials. So that's where my concern is. But I do agree that there are some things the state can focus on. Would love to see it do that. And I think if it focuses on that, it might do a better job through DPH than trying to be all-inclusive and really getting into things that are already established by medical and healthcare professionals. Thank you.
Thank you, Senator Gordon. Representative Mara.
Thank you so much, Madam Chair. And I think this is just a testament, I think, to good debate, because I came in here with lots of questions and assuming I would probably be a no on something like this. But I appreciate the back and forth. I mean, especially when we look at things like gene therapy, where we know there's a lot of rare diseases and possible grants. I can see a real use for something like coordination and efforts of grants. I agree with the senator that raised the issues of delving into advice on how-to therapy and things like that, that I think maybe some wording could be changed, and I hope that we can move to where this is a better bill in the long run, but I will be supporting it today because I can see usefulness with that. Thank you.
Thank you, Representative Mara. Further discussion on this item? Seeing none, I will also just thank Mr. Clark for being here with us today and ask Mr. Administrator if you would kindly call the roll.
This is a roll call vote to JF to the floor, Senate Bill 451. Senator Anwar.
Senator Anwar votes yes.
Representative McCarthy Vahey.
McCarthy Vahey votes yes.
Representative Belton.
Belton votes yes.
Senator Marks. Senator McCrory. Senator Sommers. Representative Clara DeStitria.
Clara DeStitria votes no.
Representative Berger Travallo.
Berger Travallo votes yes.
Representative Biggins.
Biggins votes yes.
Representative Carpino. Representative Delphineus.
Rep. Dauphiné votes no.
Representative D'Amico.
D'Amico votes yes.
Representative Elliott. Representative Ganga. Ganga.
Yes. Yes.
Representative Gilchrist.
Representative Gilchrist votes yes.
Senator Gordon.
Senator Gordon votes no to flag it.
Senator Hockaday. Representative Cavros DeGraw.
Gavros DeGraw votes yes.
Representative Kitt.
Representative Kitt votes yes.
Representative Kennedy.
Kennedy votes yes.
Senator Kushner. Representative Mara.
Mara votes yes.
Representative Martinez. Representative Morambello. Representative Parker. Representative Paletta.
Yes.
Senator Rahman. Representative Reddington Hughes.
Reddington Hughes votes no.
Representative Romano.
Romano votes yes.
Senator Slapp. Representative Steinberg.
Yes.
Representative Zupkis. Is there anyone's names I have not called or anyone who has recently entered the room? That is the roll, Madam Chair.
Thank you very much, Mr. Administrator. Again, votes will be held open until 4:30 p.m. today. Moving on to item number 3 on our agenda. This is House Bill number 5322. This is an act concerning a working group regarding endometriosis. This is a JFS to the floor, LCO 3255. I'm wondering if there is a motion online.
So moved.
Moved by Representative Gilchrist. There may be a second online.
Second.
Seconded by Representative Kennedy. The bill before us is thanks to the good work of those two representatives, the leadership of Representative Gilchrist, Representative Kennedy, and many others on this committee are why we are here. And we would like to, today, put this working group into statute. It would establish a 20-member endometriosis working group. It would be coordinated and administrated by the Commission on Women, Children, Seniors, Equity, and Opportunity. And to really continue the good work that has been done, it would evaluate and make recommendations on endometriosis diagnosis, treatment, research, education, and public awareness in Connecticut. This S language, it expands the topics, for one. It also changes the appointment protocols to be a more traditional appointment made by the Speaker, the minority leaders, the Senate President, et cetera. It sets some requirements for the way the working group operates in terms of leadership and administrative support, as well as terms, and it requires an annual report. I will say that I do believe we may see some other changes to this in terms of just the logistics of it, working together with Rep. Kennedy and Rep. Gilchrist to just assure that this work, that this good work that's been done can continue. Is there discussion on this? Representative Gilchrist.
Thank you, Madam Chair. Just want to thank the committee for raising this bill. When we started, and Representative Kennedy for her partnership over these years. When we started meeting back in 2021, I never could have imagined we'd get to the place we are today. We have helped to raise awareness about endometriosis, not only here in Connecticut, but nationally, and given voice to a large number of predominantly women who felt voiceless before. We've also been able to move the needle on research, and just so proud of the work we have done, and I know we will continue to do as a state. So thank you, and I will wholeheartedly be supporting this legislation today.
Thank you very much, Representative Gilchrist. Representative Kennedy.
Thank you, Madam Chair. I'll be brief because I don't know if my voice will last out, but echo the remarks of my my partner in crime, if you will, there. But thank you for the committee to raise this this year to keep this flow going. We have done an incredible amount of work in all the years. That's nearly 4.5, and the attention that's brought to so many women that have suffered needlessly, really, and continue to suffer, but we will continue to bring more education to this topic. And I really look forward to this continuing. Like Representative Gilchrist said, we're known around the country now for the work that we have done through here with UConn, with Jackson Laboratories. So I just want to say thank you, and I hope everyone will fully support this today. Thank you, Madam Chair.
Thank you very much. And while your voice may be soft today, we know it's been loud on this issue for many years. So thank you both. Seeing and hearing no other discussion on this item, Mr. Administrator, would you kindly call the roll?
This is a roll call vote on House Bill 5322, LCO 3255 to be JFS to the floor. Senator Anwar.
Senator Anwar votes yes.
Representative McCarthy-Vahey.
McCarthy-Vahey votes yes.
Representative Belton.
Belton votes yes.
Senator Marks. Senator McCrory. Senator Summers. Representative Clary DeStitria.
Clara DeStitria votes yes.
Representative Berger-Javala.
Berger-Javala votes yes.
Representative Biggins.
Biggins votes yes.
Representative Carpino. Representative Daphnis.
Rep. Dauphiné votes, yes. I think that we're on that. Oh, no, I'm sorry, a no. I'm sorry, I wasn't paying attention. A no, apologize. Oh, I'm a yes, thank you. Rep. Dauphiné votes yes.
Thank you. Representative D'Amico.
D'Amico votes yes.
Representative Elliott. Representative Jenga.
Yes.
Representative Gilchrist.
Representative Gilchrist votes yes.
Senator Gordon.
Yes.
Senator Hockadell. Representative Kavros DeGraw.
Kavros DeGraw votes yes.
Representative Kitt.
Representative Kitt votes yes.
Representative Kennedy.
Kennedy votes yes.
Senator Kushner. Representative Mara. Representative Martinez. Representative Morambello. Representative Parker. Representative Paletta.
Yes.
Senator Rahman. Representative Reddington Hughes.
Yes.
Representative Romano.
Romano votes yes.
Senator Slapp. Representative Steinberg.
Yes.
Representative Zupkis. Is there anyone's names I have not called or anyone who has recently entered the room? That is the roll, Madam Chair.
Thank you very much, Mr. Administrator. Moving on to item number 4, House Bill number 5510. This is an act concerning the Department of Public Health's recommendations regarding unlicensed institutions and practices. This is a JFS to the floor, LCO 3504. May I have a motion?
So moved.
moved by Senator Amor and seconded by Representative Claridis Detria. This bill makes it a Class D felony to open, manage, or operate a healthcare facility without a required license. It sets a maximum $5,000 daily fine for this offense. The criminal penalty does not apply to a licensee who fails to apply for renewal or a financial institution taking ownership of a facility after foreclosure. It allows DPH to impose civil penalties up to $25,000 per day for these violations, and it specifies that DCH can issue a summary order, which means that there would be no hearing and immediate action would be taken, that someone immediately stops an illegal practice. And that is if there is a threat to public health or safety. The JFS language removes the 30-day limit on the exemption from that criminal penalty for the owner that has failed to renew their license or who has failed to renew their license. Representative Claridis Detria.
Thank you, Madam Chair. And I just want to double check for intent that this is only for unlicensed practices, and it doesn't apply to someone that inadvertently has forgotten or slipped through the cracks renewing their license through you.
Thank you. That was one of the reasons why we made that change in the S language with that 30-day renewal. Yes, this is geared towards those who are seeking to operate a facility without a license. Other questions or comments on the bill before us? Seeing, Representative Dauphiné. Oh, Senator Gordon or Representative? Okay, thank you.
Thank you, Madam Chair. I have some concerns with this bill. There's a lot of opposition, and I think there's a lot of concern about what could be deemed a medical facility just based on a conversation that could be had. It looks like the Connecticut Hospital Association opposes the bill as well. There's mostly opposition here, and I think it's the concern on where this may lead to or how it could be interpreted. And so I will be a no today. Thank you.
Thank you, Representative. Senator Gordon.
Thank you, Madam Chairwoman. One of the items that I thought was worthy of note in the testimony was from the Connecticut Hospital Association. They had raised a concern if this is going to be moved to a felony, which is a big step, then what happens if someone is submitting a license application or even a renewal, because renewal's in here, so renewal means you're already licensed, and there's a clerical or administrative error, non-intentional. So that's basically a benign act of omission. Does the JFS distinguish that from an actual act of commission, which would be purposeful and potentially in bad acting? I know the CHA raised a concern about that and had some suggested wording in their testimony. I just don't know if that concern is addressed in the JFS, or is there a plan out of committee to address what I think is a legitimate concern?
Thank you, Senator Gordon. You're taking me back to my parochial school days with Sister St. Monica, those omission and commission words. I will say that was one of the reasons why we made the change with the 30-day language. There's not explicit language in the bill that speaks to intent, whether it's that piece that CHA testified about. I think we will have some further conversations. It is a tricky line, and I think the goal and hope of this legislation, at least in the conversations that we've had among leadership, is to hold accountable those bad faith actors who are very clearly trying to evade responsibility in terms of their licensure, not to hold to account in the same way those who are inadvertently making some kind of administrative error. So will we have further conversations? Yes, I believe we will.
Thank you. I appreciate that, because I think it is important to clarify that in wording as opposed to just leaving it up to the regulatory agency to decide. That may not decide in the way that the intent is. So I think the better we can try to button up some of the wording. So I'll end up supporting this. but to flag it that there is some work to do to try to address that concern. Thank you.
Thank you, Senator. Representative Clara DeStitria.
Thank you, Madam Chair. And will this bill have to be referred to judiciary because of the fines?
Thank you for the question. It is my understanding, yes, that this would need to go through the Judiciary Committee. Seeing and hearing, Representative Biggins, go ahead.
So I know we said we're JFSing this to the floor. Do we need to JFS it to, no, okay, thank you, sorry, confused over here.
Thank you. Once the bill gets to the floor, it will end up being referred to the Judiciary Committee from there. We do sometimes refer bills directly to other committees, but in this case, we'll have it go out to the calendar and our screening team will send it along. So thank you for those clarifying questions. I think it's helpful for everyone. Okay. Mr. Administrator, would you kindly call the roll?
This is a roll call vote to JFS to the floor. House Bill 5510, LCO number 3504. Senator Anwar.
Senator Anwar votes yes.
Representative McCarthy-Vahey.
McCarthy-Vahey votes yes.
Representative Belton.
Belton votes yes.
Senator Marks. Senator McCrory. Senator Summers. Representative Clara DeStitria.
Clara DeStitria votes yes.
Representative Berger Javallo.
Berger Javallo votes yes.
Representative Biggins.
Biggins votes yes.
Representative Carpino. Representative Dauphiné.
Rep. Dauphiné votes no.
Representative D'Amico.
D'Amico votes yes.
Representative Elliott. Representative Jenga.
Yes.
Representative Gilchrist. Senator Gordon.
Yes.
Senator Hockaday. Representative Cavros DeGraw.
Cavros DeGraw is a yes.
Representative Kitt.
Representative Kitt votes yes.
Representative Kennedy.
Kennedy votes yes.
Senator Kushner.
Yes. Senator Kushner votes yes.
Representative Mara. Representative Martinez. Representative Morin-Bello. Representative Parker. Representative Paletta.
Yes.
Senator Rahman. Representative Reddington Hughes.
Reddington Hughes votes no in its present form.
Representative Romano.
Romano votes yes.
Senator Slapp. Representative Steinberg.
Yes.
Representative Zupkis. Is there anyone's name I have not called or anyone who has recently entered the room?
Rep. Elliott on Zoom.
Rep. Elliott, how do you vote?
Yes.
Thank you. Is there anyone else? And that is the roll, Madam Chair.
Thank you very much, Mr. Administrator. Moving on to item number 5. This is House Bill number 5511, an act concerning the Department of Public Health's recommendations regarding consent orders. This is a JFS to the floor, LCO 3505. May I have a motion?
So move.
Moved by Senator Anwar. Is there a second?
Second.
Seconded by Representative Belton. This bill, which, as I said, has S language, will authorize the commissioner of the department to resolve enforcement actions with an agreed settlement or a consent order without the need of an administrative hearing in those cases where there is agreement. The S language does remove the provision that would have authorized the commissioner to impose conditions on issuing those or issuing or renewing permits, et cetera, conditions that she would deem necessary to ensure compliance with the regulations. Is there discussion on this item? Seeing or hearing none. Mr. Administrator, would you kindly call the roll?
This is a roll call vote to JFS to the floor, House Bill 5511, LCO number 3505. Senator Anwar.
Senator Anwar votes yes.
Representative McCarthy Vahey.
McCarthy Vahey votes yes.
Representative Belton.
Belton votes yes.
Senator Marks. Senator McCrory. Senator Sommers. Representative Clara DeStitrio.
Clara DeStitrio votes yes.
Representative Berger Travallo.
Berger Gervallo votes yes.
Representative Biggins.
Biggins votes yes.
Representative Carpino. Representative Dauphiné.
Rep. Dauphiné votes yes.
Representative D'Amico.
D'Amico votes yes.
Representative Elliott.
Elliott votes yes.
Representative Jenga.
Yes.
Representative Gilchrist. Senator Gordon.
Senator Gordon votes yes.
Senator Hockaday. Representative Cavros DeGraw.
Cavros DeGraw votes yes.
Representative Kitt.
Representative Kitt votes yes.
Representative Kennedy.
Kennedy votes yes.
Senator Kushner.
Kushner votes yes.
Representative Mara. Representative Martinez. Representative Morin-Bello. Representative Parker. Representative Paletta. Senator Rahman. Representative Reddington Hughes.
Reddington Hughes votes yes.
Representative Romano.
Romano votes yes.
Senator Slapp. Representative Steinberg.
Yes.
Representative Zupkis. Is there anyone's names I have not called or anyone who has recently entered the room? And that is the roll, Madam Chair.
Thank you very much, Mr. Administrator. Next up, we have item number 6. This is House Bill number 5512, an act concerning the Department of Public Health's recommendations regarding real property changes of ownership. This is a JF to the floor. May I have a motion? Moved by Representative Belton. Is there a second?
Second.
Seconded by Senator Anwar. This bill will change what's required when a licensed healthcare institution wants to change its ownership. It will require applicants to provide DPH the information regarding the real property owners or proposed owner, and certain information about that owner's history of regulatory compliance. It will allow DPH to waive the requirements for nursing homes if the proposed property owner won't be involved in the home's management or operations. And DPH may consider the terms of the lease and the property owner's lack of history in owning and managing nursing homes. Is there discussion on this item? Seeing and hearing no discussion, Mr. Administrator, will you kindly call the roll?
This is a roll call vote to JF to the floor, House Bill 5512. Senator Anwar.
Senator Anwar votes yes.
Representative McCarthy Vahey.
McCarthy Vahey votes yes.
Representative Belton.
Belton votes yes.
Senator Marks. Senator McCrory. Senator Sommers. Representative Clara DeStitrio.
Clara DeStitrio votes yes.
Representative Berger Travallo.
Berger Gervallo votes yes.
Representative Biggins. Representative Carpino. Representative Dauphiné.
Rep. Dauphine votes no.
Representative D'Amico,
D'Amico votes yes.
Representative Elliott,
Elliott votes yes.
Representative Jenga,
Yes.
Representative Gilchrist, Senator Gordon,
Yes.
Senator Hockaday, Representative Cavros DeGraw,
Cavros DeGraw votes yes.
Representative Kit,
Representative Kit votes yes.
Representative Kennedy,
Kennedy votes yes.
Senator Kushner, Representative Mara, Representative Martinez, Representative Morambello, Representative Parker, Representative Paletta, Senator Rahman, Representative Reddington Hughes,
Yes.
Representative Romano,
Romano votes yes.
Senator Slapp, Representative Steinberg,
Yes.
Representative Zupkis. Is there anyone's names I have not called or anyone who has recently entered the room?
Representative Biggins just entered the room.
Representative Biggins, how do you vote?
Biggins votes yes.
Is there anyone else? And that is the row, Madam Chair.
Thank you, Mr. Administrator. Moving on to item 7, House Bill number 5513. This is an act concerning the Department of Public Health's recommendations regarding various revisions to the public health statutes. This is a JF to the floor. May I have a motion? So moved. Moved by Senator Anwar. Is there a second? Second. Seconded by Representative Belton. Though this bill is a JF, it is various revisions of the Public Health Department, which, not to be confused with the committee's own various revisions, which we'll get to, but we often have ongoing conversations with the department as chairs and rankings of this committee. But for now, the bill before us does a number of things. It allows an embalmer to be appointed by the department to dispose of abandoned dead bodies or abandoned cremated remains. It requires DPH to issue death records electronically for deaths whenever they occurred. There's currently a time limitation on that. It does make some technical changes, including to the laws related to food code and specifying the commissioner's authority to adopt regulations to implement the food code laws, particularly related to audits of local health department food protection programs. It makes changes to the MOLST program, which is Medical Orders for Life-Sustaining Treatment. It allows providers to give patients a signed copy rather than original, and says that a MOLST is invalid unless it is completed on the DPH form and executed properly. It allows the Department of Public Health's program for HIV PrEP, which is the pre- and post-exposure prophylaxis drug assistance, to also fund the associated lab testing and the related costs. Is there discussion on this item? Representative Claridis Detra, to be followed by Senator Gordon.
Thank you, Madam Chair. My questions are on the MOL section with the concerns from CHA, if we'll be addressing that, because they seem to have some serious concerns about that, the language in lines 229 through 232, if we'll be addressing that.
Thank you for the question, Rep. Claridis Detra. And as I mentioned at the beginning, and as you know, but for everyone to know, we tend to keep a running list of our conversation to be having with the department and also with the hospital association. And this is one of those areas that I think we need to discuss to see if we can come up with language that will work for all. I don't know exactly where we will land, but this is on that list of discussion items. Thank you, Representative. Senator Gordon.
Thank you, Madam Chairwoman. And I have concerns relative to where the current standing is. I have to vote on the bill that's before me. And I'm concerned about the wording relative to the medical orders for life-sustaining treatment. I think that the Connecticut Hospital Association's written testimony is spot on when it talks about concerns relative to what's in this bill. I would love to have a JFS on it because their testimony was really good and actually speaks to what happens in the real world for caring for people. Not everybody who has orders for life-sustaining treatment needs to have a MOLST form completed. They're helpful, and they can be, and sometimes it takes time for people to work through what they want and not want to put on a form versus certain specific things relative to their care. And those are valid medical orders that healthcare professionals put in every day and don't have to be on a MOLST form. And that's the reality of medical care. I think the CHA testimony is important when they talk about their concerns with the wording of this bill. They do talk about lines 229 to 232, and then at the second page they also suggest some new wording, which I think actually does make sense, that won't limit orders being taken even if they're not on a MOLST form. So I think two of their items right then and there are important and could easily make a JFS, but I would hope that out of committee those items are addressed because they do get into, number one, I think strengthening what the intent of MOLST is, and number two, not interfering with care that may look like it's part of MOLST, but actually doesn't have to be on the form. We write orders all the time, although we don't write them anymore. We put them into computers and have our electronic signature. So for those concerns, which I think are very legitimate real-world concerns, I'm going to vote no to flag this bill. But I very much look forward to seeing what can be done to address those concerns. I think they're very easy fixes, especially since CHA has already provided us wording. Thank you.
Thank you, Senator Gordon, for that. And I will just add, I'm glad that we're having this conversation related to those MOLST orders, as well as just doing what we can as a committee to help assist at those very difficult and painful times for families so that they have options and clarity. And certainly we will be continuing the conversation. Senator Anwar.
Thank you, Madam Chair. Madam Chair, the two of us have had conversation on this part as well. I think I'll align some of my comments with Senator Gordon as well. In these difficult moments when a clinician is managing a very important conversation, the last thing should be on their list is to figure out how the computer system will work and will there be a system at the state level which would allow them to put that data in. And that shouldn't be the worry of the person. The worry should be the patient 100%. So we need to navigate this in a manner where the patient who's at the center of everything at that particular moment and their family, they should get 100% of the attention, and we can navigate how do we do the other part for the record keeping and coordination. And so I will be voting yes, but I look forward to the conversation and make sure we do the right thing for the patient.
Thank you, Senator Anwar. Let me just check online. Seeing no other discussion, Mr. Administrator, would you kindly call the roll?
This is a roll call vote to JF to the floor, House Bill 5513. Senator Anwar.
Senator Anwar votes yes.
Representative McCarthy-Vahey.
McCarthy-Vahey votes yes.
Representative Belton.
Belton votes yes.
Senator Marks. Senator McCrory. Senator Sommers. Representative Clara DeStitrio.
Representative Claire DeStitrio votes no to flag.
Representative Berger Dravallo.
Berger Dravallo votes yes.
Representative Biggins.
Biggins votes yes.
Representative Carpino. Representative Dauphiné.
Rep. Dauphiné votes no.
Representative D'Amico.
D'Amico passes.
Representative Elliott.
Elliott, yes.
Representative Jenga.
Yes.
Representative Gilchrist. Senator Gordon.
Senator Gordon votes no to flag.
Senator Hockedal, Representative Cavros DeGraw,
Cavros DeGraw votes yes.
Representative Kitt,
Representative Kitt votes yes.
Representative Kennedy.
Kennedy votes no.
I'm sorry, Representative, I didn't catch you. Could you please repeat your vote?
Nope. Kennedy votes no.
Thank you.
Thank you.
Senator Kushner,
Senator Kushner votes yes.
Representative Mara, Representative Martinez, Representative Morambello, Representative Parker, Representative Paletta,
No.
Senator Rahman, Representative Reddington Hughes,
Reddington Hughes votes no.
Representative Romano,
Romano votes no.
Senator Slapp, Representative Steinberg,
Yes.
Representative Zupkis. Is there anyone's name I have not called or anyone who has recently entered the room? And that is the roll, Madam Chair.
Thank you very much, Mr. Administrator. Moving next to item number 8, this is House Bill 5514, an act concerning various revisions to the public health statutes. This is a JFS to the floor, LCO number 3466. May I have a motion? So moved. Moved by Senator Anwar. Is there a second? Second. Seconded by Representative Belton. As I noted in our last item, this is the committee's various revisions bill, and it has a number of items which I will outline. First, it allows an infirmary or healthcare facility operated by an educational institution to provide care to dependent family members if those family members are enrolled in the institution's health plan. It second prohibits the DDS from notifying or giving copies of original or investigation reports of alleged abuse and neglect to a parent or guardian if they are or live with the alleged perpetrator. It requires the DPH commissioner to establish a working group to advise the department on managed residential communities that provide assisted living services and whether these should be licensed. The fourth item, with thanks to the Vision to Learn folks, it allows nonprofits who provide glasses to get those glasses to the wearer's authorized representative, so we make sure that we get the glasses in the hands of those students. Next, it requires healthcare providers to notify patients in writing at the initial intake of the amount of time that their records that are required to be kept and how a patient can request copies of those records. It updates the name of Leading Age Connecticut to Leading Age Connecticut and Rhode Island in section 6 through 8. It requires the Board of Examiners in Nursing to develop a standardized form for nursing schools to report the NCLEX, or the National Council Licensure Examination, passage rates and other related data, and it requires the schools to report this data every 6 months. It requires DPH to collaborate with DEEP related to the sewage disposal working group that was established by this committee and the legislature last year, specifically on the feasibility and implications of implementing these recommendations from that final report, especially the nitrogen assessment and disposal systems portion. And finally, it repeals a statutory cap of $125,000 on executive director salaries in DDS, DEMIS, and DSS specifically, and other state agencies, calculations of grants to private agencies that provide employment opportunities, day services, or residential facility services. There is S language. This does add a representative to that working group on the MRCs, and it requires the NCLEX passage rates and other data to be annual rather than biannual, and makes changes to the type of data reported. Is there discussion on this item? Senator Gordon.
Thank you, Madam Chairwoman. I have a question about Section 5. I just want to clarify. I have no problem that patients know how long medical records are to be held for, although many times on computer systems they kind of stay there indefinitely, and also how to request copies. And I know there's been some problems, including in Northeast Connecticut, with people who lost access to pro-health physicians in Putnam, trying to figure out how to get their records in that whole process, which has become a mess and in part has hurt patient care. It's not the patient's fault. But one thing I just want to clarify is if each healthcare professional is to notify, I'm assuming that that would cover that if someone's part of a hospital, it's the responsibility of the hospital, not the individual healthcare professional, to provide that information. If the hospital doesn't, the hospital's liable, not the individual healthcare professional.
Thank you for the question, Senator Gordon. I'm not sure that I can answer that definitively today. The provider as part of a system, is your question related to a provider who is providing care at the hospital versus a provider providing care independently or part of a practice that may be affiliated or otherwise not affiliated with the hospital?
What I was, Madam Chairman, what I was talking about was for healthcare professionals, for example, someone's in solo practice, they're the ones that set what's happening with their office. But we have a lot of physicians and other healthcare professionals who are employed by hospital systems, and there's no lack of forms that go out that they don't hand out personally, but the hospital system takes care of, especially at intake. So I just want to make certain that if someone is part of a medical group at a hospital and the hospital fails to provide that information, which they're supposed to if this becomes law, that it's the hospital that's liable. We're not holding the individual healthcare professional liable because they otherwise wouldn't know because their systems, they're not the ones giving out that information, or for that matter, even aware of the whole bunch of paperwork that might be given out at any particular time at the front office, so to speak.
Thank you for the question. I can get clarification on that, but my assumption and understanding in this language would be that it would be the hospital, if a patient was coming into the hospital, that it would be the hospital's responsibility to provide that notification. If a patient was coming into an office to see an individual doctor, it would then be that office's, or whether solo practitioner or the practice together. So essentially, the place where that patient was entering service would be my understanding, but we can get clarification on that as well.
Thank you. I appreciate it. That's my understanding, but it's good to get the intent out because sometimes you never know what the agencies do. So thank you.
Thank you for that. Senator Almore.
Thank you, Madam Chair. I just want to speak briefly about the Section 2. And this is, at times the families have approached perhaps many of us, at least they had approached me. And this is a situation where they had a child who's a DDS client, and the family had been worried about neglect and abuse. And they had requested an investigation to be performed, and the investigation was performed, but they were never informed about it. And it would be something that one would think is a basic expectation, that somebody who's asked for the investigation and they are not necessarily the perpetrators of the neglect or abuse, they would be getting that information. It turns out that the DDS said that they're not required to share that information. So we are now putting this into legislative language to make sure that if there is an investigation, the family, the guardians or the parents would be able to get that information. And that's important to the families, but also is one of the better ways to manage the situation. I was surprised that we had to write a bill about this, but here we are. Thank you.
Thank you very much, Senator Amwar. And I will point out that there is a bill also in the Human Services Committee, and Representative Gilchrist and I will work together along with Senator Lesser and Senator Amwar to just make sure that we are clarifying and confirming language, because I think this is an issue that has come up in a few different places and with a few different folks. So I appreciate your comments, Senator Amwar, and the work on this. Representative Reddington Hughes.
I just wanted to mention the the mention of the patient's intake and their records really was born out of some things in my own district where, you know, we have patients that have medical conditions that would benefit greatly from a past history. And because of the way that the system is set up, there are a lot of people out there that don't realize that their records, you know, are not required, okay, to be retained for anything longer than 7 years. And sometimes that piece of medical history is very important. So this is really an attempt of patients being able to take control of their own medical records and to really have, you know, that information. So should they need it in the, you know, future, that they actually have ownership of it. So I think that this is really being able to, you know, advocate for yourself and to take responsibility. Thanks.
Thank you, Representative, and I want to thank you for having brought this to us, not just this year, but last year. And this was maybe not exactly the proposal you had suggested, but a way to get there so that people were aware. And I think some of us on the committee who are not working in the medical field daily did not realize that time limit. So it is about trying to empower the patients, and I thank you for your comments. Representative D'Amico.
Thank you, Madam Chair. I appreciate all the changes that are included in this revisor bill, as it were. And I especially appreciated your comment earlier in the meeting about your parochial school training regarding errors of omission and errors of commission. And I believe I have identified an error of omission in this legislation. So as you may recall, during the public hearing on this bill, we had testimony, in-person testimony, from the Citizens Coalition for Equal Access, and the testimony pointed out the lack of enforcement of what I consider to be an important piece of legislation that we did 2 years ago, Public Act 24-113, having to do with the availability of accessible medical diagnostic equipment. So again, in the testimony, it was pointed out that advocates have been trying to get the Department of Public Health to check on compliance with that legislation for the past couple of years without much success. In the testimony, it was pointed out that that a couple of suggestions were made about enforcing and strengthening that legislation. Specifically, a requirement for the Department of Public Health to do inspections for non-compliance, or just a simple matter of requiring medical facilities to report their compliance efforts. So there is nothing about that effort or that potential legislation in this bill, so I would consider it to be an error of omission, and I would really appreciate an explanation as to why.
Thank you for that, Representative D'Amico. There were a number of pieces. We've had requests from other provider organizations related to other items in terms of the various revisions bill. Various revisions, as you all know, is a bill that includes a number of different items. Usually items that are not standalone bills on their own, or often a little bit more consensus. I think the decision was made to not include that for the same reasons it was made at the beginning of the session, to not be able to hear a separate bill on that item. I think all of us have acknowledged that this is an ongoing issue for us to address, but that we were unable to take that up at this point in time. There are certainly many reasons on the why, but I appreciate and always appreciate your incredible advocacy on behalf of the disability community.
So if I may, Madam Chair, I appreciate that explanation. May I request that before this bill hits the House floor, that it will, may I request that before it hits the House floor, that it includes language having to do with strengthening and getting us towards compliance with the provisions of Public Act 24-113?
Thank you, Rep. D'Amico. I can't make that promise here today. As I have said publicly and privately, and I will say again, this committee has heard some incredibly powerful testimony during my time, not this year, but I don't think that anyone will soon forget the testimony that we heard from the members of the community, the disability community, about the difficulty that they face in getting and receiving care and access to care. And this is something that we are going to need to continue to make movement on. Unfortunately, it requires a tremendous amount of time and negotiation, even when we think that it shouldn't. It does. There is an effort, and I know you and I have had this conversation, to try and secure funding, if we are able to allow for purchase of some of the equipment that is needed by our practices to be able to assure that folks can receive the care that we were trying to make sure they were receiving through the last bill that we passed. But this is something that, whether there is legislation or not, we do and will and are going to continue to have ongoing conversations. So in this legislative session, I think that the effort towards securing that funding is probably our best bet.
If I may, for a third time, Madam Chair, and then that will be it. So rather than answer you directly, I will just answer with the words of the co-chair of the Citizens Coalition for Equal Access, who was quoted in the testimony that was presented last week or 2 weeks ago. Quote, "I am 76 years old, and I've been told since childhood that now isn't a good time for taking care of my needs." Unquote. Thank you.
Thank you, Representative D'Amico. I will say that as chair of this committee, whether it is related to those facing end of life, our hospice, our disability community, from issues ranging from cancer care across the board, I wish that we could do absolutely everything all the time. And it is a very difficult decision to make, but I appreciate, as I have said many times, your advocacy, and this work is absolutely never finished, and we will continue the conversation. Seeing and hearing no other, I'm sorry, Senator Kushner.
I just wanted to thank the chairs for getting involved with and understanding the importance of the Vision to Learn program. I think it's something that now we're all aware of, and hopefully we will see it thrive in many of our communities. So I wanted to thank the chairs for getting this done.
Thank you, Senator Kushner, for your advocacy as well on this issue. It's been very valuable. Mr. Administrator, if you would kindly call the roll.
This is a roll call vote to JFS to the floor, House Bill 5514, LCO number 3466. Senator Anwar.
Senator Anwar votes yes.
Representative McCarthy-Vahey.
McCarthy-Vahey votes yes.
Representative Belton.
Belton votes yes.
Senator Marks. Senator McCrory. Senator Sommers. Representative Clara DeStitria.
Clara DeStitria votes yes.
Representative Berger Travallo.
Berger Travallo votes yes.
Representative Biggins.
Biggins votes yes.
Representative Carpino. Representative Dauphiné.
Dauphiné votes yes.
Representative D'Amico.
D'Amico votes no.
Representative Elliott.
Elliott votes yes.
Representative Jenga.
Yes.
Representative Gilchrist. Senator Gordon.
Yes.
Senator Hockendahl. Representative Cavaros DeGraw.
Cavaros DeGraw votes yes.
Representative Kitt.
Representative Kitt votes yes.
Representative Kennedy.
Kennedy votes yes.
Senator Kushner.
Kushner votes yes.
Representative Mara. Representative Martinez. Representative Morambello. Representative Parker. Representative Paletta. We'll come back. Senator Rahman. Representative Reddington Hughes.
Reddington Hughes votes yes.
Representative Romano.
Romano votes yes.
Senator Slapp. Representative Steinberg. Representative Zupkis. Is there anyone who has recently entered the room or anyone's names I have not called?
Representative Paletta, are you able to unmute? We're not able to hear you here. Okay. Rep. Paletta, if you can hear us, just know that we did not get your vote for this item, but I will take this opportunity to remind everyone that votes will be held open until 4:30 today, both on Zoom and in the public health area. Rep. Paletta, one more try? Nope. Okay. We are going to move on to the next item on our agenda, which is item number 9. This is House Bill 5515, an act concerning the Department of Mental Health and Addiction Services recommendations regarding access to opioid overdose reversal medication. This is a JFS to the floor, LCO 3506. May I have a motion? So moved. Moved by Senator Anwar. Is there a second? Second. Seconded by Representative Belton. With this bill, I'd like to thank Fairfield Board of Ed member Jennifer Jacobson for bringing this issue to our attention. It really is about making sure that anyone in a school building who has Narcan and access to Narcan, and that any person is able to give over-the-counter opioid antagonists to someone to treat or prevent a drug overdose. It specifically does update the education statutes on the administration by nurses and qualified school employees, but it also more broadly addresses any person's ability to give that Narcan. It provides immunity, civil and criminal immunity, and it also exempts the free distribution of Narcan, these medications, from the non-legend drug permit requirement. So our regional behavioral health action organizations have been doing great work in helping to distribute this. So this just makes clear that the permits for those and other organizations are not required. Is there discussion on this item? Mr. Administrator, would you kindly call the roll?
This is a roll call vote to JFS to the floor, House Bill 5515, LCO number 3506. Senator Anwar.
Senator Anwar votes yes.
Representative McCarthy-Vehy.
McCarthy-Vehy votes yes.
Representative Belton.
Belton votes yes.
Senator Marks.
Senator Marks votes yes.
Senator McCrory. Senator Sommers. Representative Clara DeStitria.
Clara DeStitria votes yes.
Representative Berger-Javallo.
Berger-Javallo votes yes.
Representative Biggins.
Biggins votes yes.
Representative Carpino. Representative Dauphiné.
Rep. Dauphiné votes yes.
Representative D'Amico.
D'Amico votes yes.
Representative Elliott. Representative Jenga.
Yes.
Representative Gilchrist. Senator Gordon.
Yes.
Senator Hockadell. Representative Cavros DeGraw,
Gavros DeGraw votes yes.
Representative Kit,
Representative Kit votes yes.
Representative Kennedy.
Kennedy votes yes.
Sorry, Representative, I didn't quite catch you. Can you please
Kennedy
repeat?
votes yes.
Thank you.
Thanks.
Senator Kushner.
Kushner votes yes.
I'm sorry, Senator, I didn't catch you. Could you please repeat?
Kushner votes yes.
Thank you. Representative Mara. Representative Martinez. Representative Morambello. Representative Parker. Representative Paletta.
Rep. Paletta votes yes.
Senator Rahman. Representative Reddington Hughes.
Reddington Hughes votes yes.
Representative Romano.
Romano votes yes.
Senator Slapp. Representative Steinberg.
Yes.
Representative Zupkis. Is there anyone's names I have not called or anyone who has recently entered the room? And that is the roll, Madam Chair.
Thank you so much, Mr. Administrator. We appreciate you being here with us today. The next item on our agenda is item number 10, House Bill number 5516, an act concerning reproductive rights. This is a JFS to the floor, LCO 3484. May I have a motion? Moved by Senator Amwer. Is there a second? Second. Seconded by Representative Belton. The bill before us today will prohibit healthcare entities from limiting a provider's ability to give patients comprehensive, medically accurate, and appropriate information and counseling about both reproductive or gender-affirming healthcare services. And this can include, among other things, information on diagnosis, recommended treatments and alternatives, and potential risks. It will prohibit a healthcare entity from firing or disciplining a provider solely for giving this information or counseling. In order for these prohibitions to apply, the provider must be acting in good faith within their scope of practice and within the accepted standard of care. And under the bill, the healthcare entities may still require providers to give patients a full range of information on available legal options to comply with preferred provider network or utilization review requirements for insurance purposes, and to meet established healthcare quality and patient safety guidelines. The S language simply makes some technical changes, so nothing substantive to the underlying bill. Is there discussion? Are there questions on this item? Representative Dauphiné.
Thank you, Madam Chair. So we've had this bill in some form in the past. It's come up several sessions, and I just wanted to speak a little bit to it. We're talking about a hospital that has a deeply withheld religious belief, and when hiring individuals to work for them, it's within their contract to not allow them to go against those deeply religious held beliefs. So as I understand it from the testimony and the conversations that we've had, the individuals that work in the hospital can provide the options and where they can go for the options, but allowing them to counsel is allowing them to give advice, and that would or could go against the deeply withheld religious beliefs of that hospital. And that's where I kind of draw the line here. Giving options and sharing opportunities for them to go to other places where they don't offer those services in that facility are one thing. But allowing them to give advice and counsel against something that's deeply withheld within the hospital, which I'm not sure, I think we only have one in this state, but it specifically goes against the contract in which they they signed when they agreed to work there. So I'm a strong no on this. Thank you, Madam Chair.
Thank you, Representative. And I appreciate you raising the issue of counseling, which is something that came up quite a bit during the hearing. And we probably didn't talk about this as much then, but the definitions within the bill include medically accurate and appropriate information and counseling. The wording there means information and counseling supported by the weight of current scientific evidence derived from research using accepted scientific methods, consistent with generally recognized scientific theory, published in peer reviews as appropriate and recognized as accurate, complete, objective, and in accordance with the accepted standards of care by professional organizations. And I think there is a distinction, as you said, the difference between providing simply an opinion or perspective versus using those definitions in the bill, which is what's intended. But thank you. Thank you for your comments. Other questions or comments? Senator Gordon.
Thank you, Madam Chairwoman. I'll note that this certainly is a bill that we saw a couple years ago, actually almost identical in most of the ways. And there was a lot of active discussion at that time. And my opinion then and my opinion now has been consistent, which is I do support our individual rights, our parental rights, our medical freedoms, but we also have to understand that we have to support religious beliefs. And we've heard that when on a number of other bills, but it's also very apt when we're talking about hospitals. They happen to be Catholic hospitals, for example, that have various ethical and religious directives, and they're not held in secret. They're known. And when a healthcare professional purposefully seeks employment at a hospital that may have ethical and religious directives and accepts employment, that is, signs a legally binding contract, there is contract law. It's just not state, it's actual federal laws as well. And it could be viewed as a breach if someone goes against one of the ethical and religious directives that a Catholic hospital may have, even if they're maybe acting in good faith, but they're knowingly doing something separate from what the hospital has in place. And these aren't new. These have been in place for very long periods of time, so no one could be surprised at all, especially when you seek employment there and sign a contract, unless you didn't read the contract. So my concern is having a state law that may be well-intentioned but can go against deeply held religious beliefs. It's one thing to tell someone and give them certain types of counseling, but to also, if the institution doesn't allow them to get into treatment recommendations, that's different from making a referral for something that the hospital doesn't do for certain types of care. I just get concerned that the lines are blurred here. I think they were very much a couple years ago, and I still think it's the same. I understand the intention, and I don't deny people care, but there are certainly situations where certain hospitals, through their ethical and religious directives, don't provide certain care. This is very different from emergency care, and I highlighted that 2 years ago. Emergency care and say non-emergency care are two very different things. We have the federal EMTALA law, which is in effect, and I was one of the ones that led the charge and champion codifying it into law here in this state last year, which I think was a very good effort and bipartisan effort, and I appreciate that. But this gets into non-emergency care. And even in emergency situations, ethical and religious directives have different views on that, and certainly we've heard testimony previously about emergency care. But this would, with regards to non-emergency care, I believe gets into counter to certain hospital systems, such as Catholic hospitals, deeply held religious beliefs. I don't think that if this were to become law in the state, it would actually pass muster constitutionally at the federal level because of that. And I think it would also get into contract law and might also be viewed as countering established contract laws. So even though I do support people seeking their medical freedoms, we also can't override religious organizations and their beliefs. And so for those reasons, I'm concerned about this bill. I think if one were to rework it to cover certain scenarios, I think it can be workable. I know there will be those who will disagree with my opinions, and that's fine. But my opinions haven't changed, even though I do support overall medical care and medical freedoms. But again, getting into deeply held religious beliefs, which are well known at Catholic hospitals and their ethical and religious directives, no matter what people may say, and I'm sure we'll hear that today by some people, I don't think it's going to assuage my concerns or even fully address those concerns. So for those reasons, I'll have to vote no on this, which is consistent with my positions that I've been very public about. I'd love to see this as a work in progress to see what we can do to find common ground. Don't know if that is possible, but I think there are some serious concerns here, no matter what people may say otherwise. But I'm always happy to hear what others may say, and I think we certainly will on that today. But that's where I'm coming from. Thank you, Madam Chairwoman.
Thank you, Senator Gordon. I will just respond in terms of constitutionality questions. There's been no flag on this bill, whether from partisan or nonpartisan attorneys. We certainly do hear that when we have come up upon that as an issue. But Senator Anwar, to be followed by Representative Clara DeStitria.
Thank you so much, Madam Co-Chair. So, Madam Co-Chair, first I wanted to recognize our Catholic institutions. They provide excellent care to the best of their capacity, and they take care of some of the most vulnerable people in our state. So, and these institutions are patient-centric. And the big conversation we are having is that there's a patient-centric way of managing things, and there's a doctrine-centric way of management. And overwhelming majority of the time, they are all unified. There is a gray zone. And then that gray zone, to my colleague's perspective, is well documented and well addressed, that there is an ethical standards and guidelines that are in place, and people know it, and everybody in the state pretty much knows that. The issue comes down to is for the clinician, because the clinician does not take an oath to have the directive be the center of the patient's care. They know that that facility will not provide certain care, and that's black and white, that's clear and recognized and respected and should be respected. So they would not provide some of the care, and that's part of the ethical directive that the institution has. The clinician at the center of the situation, in very rare instances, will have to make a decision to do the best thing for the patient. And they should be able to make the patient at the center of the decision, not worried about the backlash that they may get from the institution's administration. And I think that's where this conversation is. And then what we are saying is that the patient should remain in the center while we respect the doctrine-centric management, which will work. Overwhelming majority of the cases it works because there's alignment, but there are a couple of areas where it does not. And then those areas are not something that somebody sees every single day, but should that be the case, that clinician should make the best decision for the patient. And I think that's part of the real doctrine. Even the doctrine-based perspective is the patient remains at the center of it. So I know that the clinician is not saying that I'll take you in a corner of this institution and then provide the procedure or something. They're guiding the person to the best possible place for that procedure, and they should not have a backlash. That's the bottom line, and I think it's a fair way to address this and then provide the best care to the patient, because end of the day, the patient is what both the institution and the clinician want. So back to you, Madam Chair.
Thank you, Senator Anwar. Representative Clara DeStitria.
Thank you, Madam Chair. My concerns on this bill, and we've all talked about, it should be about the patient, but we also want to protect the providers that are giving this information. And it's about information. We want to make sure that these patients are getting all their options. It's not about steering them in one direction or another, just giving them their options without opinions. And my concern is now this is creating a truly gray area. And I don't want to, I think that may be an unintended consequence. And how are we going to prove that? Is that going to be a he said, she said issue? I don't know. And those are my concerns with this today. I hope maybe we can flush out some wording in here that can clarify it a little bit better to get some of us maybe to support this. But I think for today, I'll be a no to flag it with some of these concerns. Thank you, Madam Chair.
Thank you, Representative Clara DeStitria. Representative Reddington Hughes.
My concern is that with Catholic hospitals, they are really grounded in their Catholic moral tradition. Okay, so this bill is really asking them to violate their very principles. And I say that because there has been no mention of, walking back the counseling end of this. And there is quite a big difference between counseling someone and providing them purely with information. So that's all I would say.
Thank you, Representative Reddington Hughes. Seeing no further discussion on the item, Mr. Administrator, would you kindly call the roll?
This is a roll call vote to JFS to the floor, House Bill 5516, LCO number 3484. Senator Anwar.
Senator Anwar votes yes.
Representative McCarthy Vahey.
McCarthy Vahey votes yes.
Representative Belton. Senator Marks.
Senator Marks votes yes.
Senator McCrory.
Senator McCrory votes yes.
Senator Summers. Representative Clara DeStitria.
Representative Claire DeStitria votes no to flag.
Representative Berger Gervallo.
Berger Gervallo votes yes.
Representative Biggins.
Biggins votes yes.
Representative Carpino. Representative Dauphiné.
Dauphiné votes no.
Representative D'Amico.
D'Amico votes yes.
Representative Elliott. Representative Jenga.
Yes.
Representative Gilchrist. Senator Gordon.
Senator Gordon votes no to flag.
Senator Hockaday. Representative Cavros DeGraw.
Cavros DeGraw votes yes.
Representative Kitt.
Representative Kitt votes yes.
Representative Kennedy.
Kennedy is a no to flag.
Senator Kushner.
Kushner votes yes.
Sorry, Senator, could you please repeat your vote?
Senator Kushner votes yes.
Thank you. Representative Mara. Representative Martinez. Representative Morambello. Representative Parker. Representative Paletta. Senator Rahman. Representative Reddington Hughes.
Reddington Hughes votes no.
Representative Romano.
Romano votes no.
Senator Slapp. Representative Steinberg.
Yes.
Representative Zupkis. Is there anyone's names I have not called or anyone who has recently entered the room? And that is the roll, Madam Chair.
Thank you very much, Mr. Administrator. Moving on to the next item on our agenda, number 11. This is House Bill number 5517, an act concerning the Department of Mental Health and Addiction Services recommendations regarding recovery-friendly language and various revisions to mental health and addiction statutes. This is a JFS to the floor, LCO 3507. Is there a motion?
So moved.
Moved by Senator Anwar. Is there a second?
Second.
seconded by Representative Belton. This is a very lengthy bill. Actually, I think it's 108 pages, something like that. And it updates statutory references to use what we call person-centered language. So it generally replaces the term substance abuse with substance use. And this, as the bill title says, is recovery-friendly language. It also requires DESPE to coordinate with DEMIS and DPH when deploying behavioral health professionals in certain emergency situations. It updates the membership requirements of certain Department of Mental Health and Addiction Services advisory boards, and it repeals a statutory provision related to the catchment area councils and removes those references. That function is now part of the Regional Behavioral Health Action Organization work and has changed when years ago we combined our previous mental health boards and our substance use prevention programs. Is there a discussion on this item? Representative Claridis Deidria.
Thank you, Madam Chair. Excuse me. I know CHA had some concerns, and I think most of them were addressed. But one of the additional concerns, and I don't know the exact line, but it's in the substitute language. It says the Commissioner of Public Health can take disciplinary action against licensees for alcohol or substance use, USE. By changing the word abuse to use in this context, it will significantly change the meaning of the section. So any provider who has a glass of wine on vacation could lose their license. It should be misused. Yeah.
Thank you, Representative Claridis Deidria. As I mentioned, the length of this bill, I think even when going through with a fine-tooth comb, there are times, and this is one of those, there are, I think, a few pieces in here that we are going to have to discuss, and this would be one of them. That is certainly not the intent of this bill whatsoever. The idea of moving to recovery-friendly language is not to then implicate someone who has a beer or a glass of wine with their friends or in any different setting. Thank you for pointing that out.
Thank you, Madam Chair, and I'm sure there'll be a few more changes that we'll have to make along the way. Thank you.
Yes, absolutely. This one is on the list. Representative, I'm sorry, Senator Almore? Oh, Representative Dauphiné to be followed by Representative Reddington Hughes.
Thank you, Madam Chair. And that too was concerning to me, distinguishing between, you can use a substance, for example, the wine, I think that was well illustrated, versus abuse and misuse, whichever ones you want it. But I think that it's not distinguished, right? So I'm concerned about that language. I haven't decided how I'm going to vote, but it might be a no for that reason. Thank you, Madam Chair.
Thank you, Representative Dauphiné, and certainly that will be one of the issues that we will address in working with DEMIS. Representative Reddington Hughes.
It's through you, Madam Chair. I am a little confused because I don't know, as a result of this bill, would other programs that we have already in place, like 211 residential substance abuse treatment, would all of those need to be rebranded? And what kind of fiscal note would that have?
Thank you. I think the references are really in statute. There's not a requirement to rebrand at this point, and but I do think, again, because of the extensiveness of this change, there are going to be some other conversations that we will have. I think the department has continued over the past number of years to try and move towards, like I said, the person-centered language. And sometimes there are adjustments that we're going to have to make. The specific rebranding requirements is not part of this, but your point is well taken that this is a broader conversation across both statute and work that we're doing out in the community. Senator Gordon.
Thank you, Madam Chairwoman. And I think there's a number of things that have been raised when terminology changes that's not fully consistent with what goes on in the real world. And the Connecticut Hospital Association's written testimony does highlight some of that, including when we talk about billing and the codes and things like that used and other documents used for billing purposes and coding and things like that. Those are things we don't want to have state wording be in conflict with those types of things because they can create unnecessary confusion. There is a real-world distinction, even when you're talking about recovery-friendly terminology and patient-centric terminology, between abuse, misuse, and use. We all understand those, and our constituents do. And there are those situations where someone can be using a substance, and that's perfectly legal. We all do. How many of us use Tylenol? That's a substance. That's substance use, technically. But there can be misuse, which doesn't necessarily rise to the level of abuse, but there's also abuse situations, and we understand that. Illegal drugs and alcohol tend to be ones that are commonly known, especially by lay people. But I believe that what's been highlighted a number of times for various concerns by the Connecticut Hospital Association really gets to some real-world scenarios. And it's one thing if we want to change wording, but we also have to make certain how it works in the real world. And I think as this is written now, it does create problems. And for those reasons, I'm going to vote no to flag this bill. Look forward to seeing that this bill actually can be fixed to get in line with things that happen in the real world, especially things that the Connecticut Hospital Association, I think, rightly flagged as concern and made some actually good recommendations that are not in the wording of this JFS. So those are the reasons I'm going to vote no, but it has nothing to do with not wanting to be recovery friendly. It just has to deal with, you make a change in a law comes about, you have to think about real world consequences and impacts, and we should be minimizing that and minimizing unintended consequences and doing our due diligence to really sort through all the different details and to take into account what I think are good recommendations in a constructive way by those who are giving us their testimony. So thank you.
Thank you. I think we all acknowledge there are some tweaks and fixes that are needed on this, but I will point out the intent with this language is not related to substances such as Tylenol. I think I would point to the definition of prevention, policies and programs that promote healthy, safe and productive lives and reduce the likelihood of crime, violence. Current language, substance abuse, illness, academic failure, and other socially destructive behavior. But I understand the point that you are making, and I think there's agreement that we will be continuing to work. Not I think, I know there is agreement that we will be continuing to work on this and want to make sure that the bill moves forward in committee so that we can continue that conversation. Seeing and hearing no other discussion, Mr. Administrator, would you kindly call the roll?
This is a roll call vote to JFS to the floor, House Bill 5517, LCO number 3507. Senator Anwar.
Senator Anwar votes yes.
Representative McCarthy-Vahey.
McCarthy-Vahey votes yes.
Representative Belton.
Belton votes yes.
Senator Marks.
Senator Marks votes yes.
Senator McCrory.
Senator McCrory votes yes.
Senator Summers. Representative Claritas DiTrio.
Representative Claritas DiTrio votes no to flag.
Representative Berger Javallo.
Bless you. Berger Javallo votes yes.
Thank you. Representative Biggins. Representative Carpino. Representative Dauphiné.
Dauphiné votes no.
Representative D'Amico.
D'Amico votes yes.
Representative Elliott. Representative Jenga.
Yes.
Representative Gilchrist. Senator Gordon.
No to flag.
Senator Hockaday. Representative Cavros DeGraw.
Cavros DeGraw votes yes.
Representative Kitt.
Representative Kitt votes yes.
Representative Kennedy.
Kennedy votes no.
Senator Kushner,
Kushner votes yes.
Representative Mara, Representative Martinez, Representative Morin-Bello, Representative Parker, Representative Paletta, Senator Rahman, Representative Reddington Hughes,
Reddington Hughes votes no.
Representative Romano,
Romano votes no.
Senator Slapp, Representative Steinberg,
Representative Steinberg votes yes.
Representative Zupkis. Is there anyone's names I have not called or anyone who has recently entered the room? And that is the roll, Madam Chair.
Thank you very much, Mr. Administrator. Moving on to item 12 on our agenda. This is House Bill number 5518, an act concerning Department of Public Health's recommendations regarding various revisions to the environmental health and drinking water statutes. This is a JF to the floor. May I have a motion?
So moved.
Moved by Senator Anwar. Is there a second? Second. Seconded by Representative Belton. The bill makes a number of changes. It allows the Department of Public Health to set conditions on its approval of water sources and makes some clarifying changes to the process of water testing. It makes changes to DPH's oversight of environmental laboratories, requiring certain out-of-state laboratories to get departmental approval before operating service centers, otherwise known as collection sites in the state. And it makes changes to the laws on asbestos professionals. It exempts crematories that perform only alkaline hydrolysis at funeral homes from the restrictions that currently exist on crematories being near residential properties, and also allows policies and procedures before regulations on that. Is there discussion on this item? Representative D'Amico. Representative D'Amico.
Thank you, Madam Chair. So, Madam Chair, I'm looking at testimony on this bill from the Connecticut Water Works Association, and they raise a concern about the Uniform Administrative Procedures Act, or UAPA, being superseded by the Department of Public Health. And they list various reasons as to why that is not a good idea. I presume you're familiar with that testimony. I was just wondering if that concern is considered to be valid.
Thank you very much, Representative D'Amico. As you see from today's agenda, the Department of Public Health has a number of items on the agenda, and we have, as I've mentioned a few times, the running list. This is a conversation that we have not completed with either the folks who have provided testimony and the department, but it is something that we will be following up on.
Okay, so this could get changed in the final iteration of the bill. I guess, is that a fair statement?
Yes, it could, and what I'm saying is we haven't had enough of a thorough conversation to assess the various perspectives. It's an understandable concern in terms of the changes to process, and I think it's one we need to talk out.
Okay, thank you.
Thank you, Representative. Senator Gordon.
Thank you, Madam Chairwoman, and I agree with my good colleague, Rep. D'Amico. The Connecticut Water Works Association testimony, I think, is spot on. They raise legitimate and serious concerns about giving authority, in this case to Department of Public Health, to, in a sense, do certain rulemaking and not have to follow the UAPA. I think we should be very concerned in any bill at any time that gives any state agency authority to do things outside of certain processes. I think that weakens transparency, and also I believe weakens overall oversight that we should have over agencies that do various rulemaking that have the effect of law. I think that should be not allowed. So I would hope that that can very much be addressed. I think their concern is very legitimate. I can see where if their concern isn't addressed, things can go wrong, and we would then have to try to come back at some time and fix it. So I'm going to vote no on this based upon the wording of the bill and to flag what I think is a serious concern, and I welcome the comments about wanting to look into this further and see what we can do to address it. Thank you.
Thank you, Senator Gordon. Seeing no, Representative Reddington Hughes.
I'm just, through you, Madam Chair, I'm just curious as far as the owners of properties that needed to notify tenants when the water testing finds contaminants that were laid out in the DPH schedule. Would that also include solar farms? Because they, many times are over aquifers.
Representative Reddington Hughes, I don't know that I can answer your question today. I think I'm going to have to get back to you on that one. Thank you for that question. Seeing and hearing no other discussion on the item, Mr. Administrator, would you kindly call the roll?
This is a roll call vote to JF to the floor, House Bill 5518. Senator Anwar.
Senator Anwar votes yes.
Representative McCarthy-Vahey.
McCarthy-Vahey votes yes.
Representative Belton.
Belton votes yes.
Senator Marks.
Senator Marks votes yes.
Senator McCrory.
Senator McCrory votes yes.
Senator Summers. Representative Claridis DiTrio.
Claridis DiTrio votes no to flag.
Representative Berger-Javallo.
Berger-Javallo votes yes.
Representative Biggins.
Biggins votes yes.
Representative Carpino. Representative Dauphiné.
Dauphiné votes no.
Representative D'Amico.
D'Amico votes yes.
Representative Elliott. Representative Jenga.
Yes.
Representative Gilchrist. Senator Gordon.
No to flag.
Senator Hockaday. Representative Cavros DeGraw.
Cavros DeGraw votes yes.
Representative Kite.
Representative Kitt votes yes.
Kit, my apologies.
That's all right.
Representative Kennedy.
Kennedy votes no.
Senator Kushner.
Senator Kushner votes yes.
Representative Mara. Representative Martinez. Representative Morin-Bello. Representative Parker. Representative Paletta. Senator Rahman. Representative Reddington Hughes.
No.
Representative Romano.
Romano votes no.
Senator Slapp. Representative Steinberg.
Representative Steinberg votes yes.
Representative Zupkis. Is there anyone's name I have not called or anyone who has recently entered the room?
Yes, Mr. Clerk. Representative Mara votes no.
Thank you.
Thank you.
Is there anyone else who has recently entered the room? That is the roll, Madam Chair.
Thank you very much, Mr. Administrator. As a reminder, the votes will be held open today until 4:30 on Zoom and in the public health area up on the third floor. And before we go to the last item on our agenda, I'll ask folks to stick around at the end because we want to be able to say some thank yous, if you can. So this is item number 13, House Bill number 5519, an act concerning the Department of Public Health's recommendations regarding on-site wastewater specialists and water operator apprentices. This is a JFS to the floor, LCO 3509. May I have a motion?
So moved.
Moved by Senator Anwar. Is there a second?
Second.
seconded by Representative Belton. This bill will create a certification program for on-site wastewater specialists and requires anyone performing the duties of an on-site specialist to become certified by the department and appointed by a local health director. It also will allow the Department of Public Health to certify apprentice operators for water treatment plants, water distribution systems, or small water systems. And they must complete a State Department of Labor approved apprenticeship and pass a written exam. And it will also require DPH and the Department of Labor and a nonprofit to develop and implement this apprenticeship program. This will help us address some of our workforce issues in this area. Is there discussion on this item? Representative Reddington Hughes.
Through you, Madam Chair, I would just like to say that, this is a really great solution for the shortage that we have right now. And I think that it will certainly encourage people to come forward. Thanks.
Thank you for that, Rep. Reddington Hughes. I agree, and I appreciate the work that's been done on this. Seeing no further discussion on this item, Mr. Administrator, would you kindly call the roll?
This is a roll call vote to JFS to the floor. House Bill 5519, LCO number 3509. Senator Anwar.
Senator Anwar votes yes.
Representative McCarthy Vehi.
McCarthy Vehi votes yes.
Representative Belton.
Belton votes yes.
Senator Marks.
Senator Marks votes yes.
Senator McCrory.
Senator McCoy votes yes.
Senator Summers. Representative Claritas DiTrio.
Claritas DiTrio votes yes.
Representative Berger Javallo.
Berger Javallo votes yes.
Representative Biggins.
Biggins votes yes.
Representative Carpino. Representative Dauphiné.
Dauphiné votes yes.
Representative D'Amico.
D'Amico votes yes.
Representative Elliott. Representative Jenga.
Yes.
Representative Gilchrist. Senator Gordon.
Senator Gordon votes yes.
Senator Hockaday. Representative Cavros DeGraw.
Cavros DeGraw votes yes.
Representative Kitt.
Representative Kitt votes yes.
Representative Kennedy.
Kennedy votes yes.
Senator Kushner. Representative Mara.
Mara votes yes.
Representative Martinez.
Excuse me, I'm sorry, I was having trouble unmuting, but can I cast my vote in the
Senator, how do you vote?
Yes.
Thank you. Representative Morin-Bello. Representative Parker. Representative Paletta. Senator Rahman. Representative Reddington Hughes.
Yes.
Representative Romano.
Romano votes yes.
Senator Slapp. Representative Steinberg.
Representative Steinberg votes yes.
Representative Zupkis. Is there anyone's name I have not called or anyone who has recently entered the room? And that is the roll, Madam Chair.
Thank you very much, Mr. Administrator. Again, votes will be held open until 4:30 today on Zoom or in the public health area. Before we recess our meeting, I would just ask your indulgence for a few moments. As you recall, at our last meeting, we had the opportunity to thank Beverly Henry, who isn't here with us today. I would not miss the opportunity, even in her absence, to again say thank you. But there are a number of thank yous to the people behind the scenes who make this work possible, who literally we would not be able to do this work without. And we say that but it's actually the literal truth. And I want to make sure, and we collectively as leaders of the committee want to make sure that we say thank you today to those behind the scenes. And that includes our clerk, Diane Young-Rodney, and upstairs with her assistant clerks, Kathleen Panazza, otherwise known as The Voice, and Dave Ratcliffe. Kathleen and Dave have been working with this committee for a number of years. They also will be retiring at the end of this year, which will be a tremendous loss for our committee. And we want to thank them not just for their work this year, but for the work that they've done over many years. We appreciate you so much. This year, we also had joining us Rebecca Highland, who's here in the room with us as an assistant clerk. And we also have Dave Kaplan, who is just a tremendous support to this committee and to so many other groups. In addition to those folks, we had some interns this year who helped support the work of the committee. Abigail Shaw, who's been working alongside our administrator, Antonia Campbellis, and Emily Goins, who also helped with some hearings. And I also want to thank, and I know we will hear other thanks, behind the scenes and with us, our caucus policy teams. And I want to thank Molly O'Connor, Emily Zambrella, Adam Johnson, and Jared Pico for your constant work and partnership with all of us. The foundation of this work, the people who write the laws and analyze the laws, our nonpartisan team, who are literally there with us every step along the way. And I want to say a special thanks to Eileen Lawler-Parker, Nick Panzarella, James Orlando, and Nicole Dubé, who's with us behind the scenes. These four leaders are just tremendous. And for anyone who doesn't know, they are just an incredible asset, not just to this committee, but to the General Assembly and to the state as a whole. And we're very, very fortunate. And I also want to say thanks to the folks at CTN and the building services folks, because we did have some technical issues this year, and we had a lot of help and support. Thank you to the team from Legislative Management for helping us to address. We haven't had the same sound issues that we did at the beginning of the session. And just a final thanks from me, and then I'm going to turn it over to my fellow leaders. To every person who has come before this committee this year, everyone who has testified, everyone who submitted testimony, to all of you who have reached out, we appreciate you and are grateful for that. And with that, I'm going to turn it over to Senator Anwar.
Thank you so much, Madam Chair. Madam Chair, you've covered everyone. I just wanted to say thank you for making sure everyone is covered with respect to getting our appreciation for people who have worked so hard behind the scenes. When you look at the number of bills and all that goes on, the short session, we do the same amount of work, except we have 2 less months to do it, which makes the lives of everyone doing the work a little bit challenging. But I wanted to thank some people that I want to make sure that it's important to do that. That would be you, Madam Co-Chair, for the work that you do. Thank you for your diligence and commitment and hard work. And our ranking members as well. There are many days of the entire session that we spend more time together than we do with our families, and there are many days where the rest of the committee, during public hearings, we spend more time with each one of us around here, virtually or otherwise, than we do with our families. So, and our vice chairs as well, who have been diligent in every aspect and very much involved in the decision making. Representative Belton, thank you. Senator Marks, thank you for your work and all you do. It's truly, it's a very emotional committee because we are talking about humans and what happens to them. And we deeply care, and then sometimes we differ on opinions, and then that's where sometimes we have some rubs. But at the same time, we also respect the fact that everybody deeply cares about the issues that are and the people in the state of Connecticut. So I feel blessed to be working with many of my colleagues over here. I want to mention 2 other individuals. One was, this was the first session after some 20 plus years or so without Representative Kevin Ryan, so he's missed and he's loved. And another person, Representative Jenga, who's been in this committee for some 20 years, and he's decided that he doesn't love us anymore. He's not going to run then. So I wanted to thank you, Representative Jenga, for your insight and your votes and your presence and also your conviction on so many issues that has helped me personally in looking at some of the work that we do. So thank you for your leadership and your work. Back to you, Madam Co-Chair.
Thank you, Senator Anwar. Representative Clara DeStitria.
Thank you, Madam Co-Chair, and I'll echo the comments of my co-chairs. There's so many people to thank. We need to thank the support staff because especially Beverly and her staff that keep us going every day. The voice, Kathleen, who we will miss, deeply. Dave, who's always getting my ranking member reports ready for me, lickety split, making sure I do what I need to do. I need to thank Adam Johnson and Jared. Without them, my job would be nearly impossible because they're always there to answer questions and give us write-ups and keep our caucuses on point. LCO, Nick, Eileen, Nicole, and James, thank you for your constant nudging of we can't do that, we don't have time, it's not going to work. So thank you for that. My co-chairs, even though we disagree a lot, I appreciate the open dialogue that we constantly have back and forth. I know a lot of other committees aren't afforded that, so I do appreciate doing that. And last but not least, I need to thank these people to my right, the House and Senate Republican caucus. We know there's no other caucus we'd rather be in. It's the best two caucuses in this building. And with that, thank you, Madam Chair.
Thank you very much, Rep. Clara DeStitria. And I was to share your words last but not least, really first, is thanks to the members of this committee, to my fellow leaders, Senator Anwar, Senator Summers, Rep. Clara DeStitria, and every single one of you on this committee for your passion, your dedication, your kindness, your care, and your persistence. So onward we go. With that, we will be in recess, and the votes will be held open again until 4:30 today, and we'll see you out on the floor.
Clerk, are you still there?
Yes, we're here, Senator.
How you doing?
Hold a
Did I?
second.
Okay.
I'm very well. Waiting until we clear the room. Could you hold a second, please?
Yes.
Thank you for your patience, Senator, and the others also online. Please give me a second.
Okay.
Yes.
From Mara.
Yeah, she was the first.
No, I have to do them all. Do you need me to sit?
Oh,
Can I do them
okay.
here?
I can do it right
Okay,
here. All right, let me Turn the camera on. Could you come here, please, so I can have you on camera properly?
Oh, here. No, I know you're. No, then I'm good, then I'm good. I've been seeing you. I'm setting up a meeting. I need a meeting. Sometime tomorrow. Okay. Being funny, like.
Yeah, that's what I'm trying to do. So for SB 194, how do you? Yes, you did that one already. 451? Yeah, you're on your own. This one, HB 5322. 5510. Yes.
Yeah. No, no. Yeah.
5511.
Yes.
5512. HB 5513.
No.
HB 5514.
Yes.
HB 5515.
Yes. I think get there another day.
5516.
No. We're gonna chat on, you're here Wednesday.
5517.
No. Okay, so we like train it.
5518.
No.
Okay, and you also asked to be voted for that one. Thank you so much.
Yeah, well, it's only one. I
Yep,
think
you
we
vote.
just didn't have me on film, maybe? You.
Yes,
came early.
yes. Can I see you?
Yep.
Okay. So Rep. Reddington Hughes, how do you vote on SB 194?
That was the first one, yes, yes, that I, yes.
Okay, thank you so much. Your
You're
vote
very
has been
welcome.
recorded.
Yeah, thank you.
Bye.
I think we had,
Representative Carpino, I missed them all, if it's helpful to start.
Okay.
Yeah.
How do you vote for?
Bell, I don't even speak to him. Probably have to vote on all at the same
I
time.
do, I have to
Okay.
vote on everything. I'm waiting. Okay, so, so Rep. Carpino,
194, right?
yes, how do you
Yes.
vote?
Yeah.
SB 451,
Yes.
HB 5322,
Yes.
5510,
Yes.
5511,
Yes.
5512,
Yes.
5513,
Yes, please.
5514,
Yes.
5515,
Yes.
5516,
Yes.
5517,
No.
5518,
No.
5519.
Yes.
Okay, your
No, that's
votes
fine.
have been recorded. Thank you.
11 kids, not 10 there.
Hi, Rep. Lauren Bello.
Yep. Okay, so.
I missed all of the votes
Oh,
because I
okay.
was in a GAE same time, so
Yeah, very busy time.
yes.
Okay, Rep, how do you vote on SB 194, 451, 5322, 5510,
Yes.
5511,
Yes.
5512,
Yes.
5513,
Yes.
5514.
Yes.
5515.
Yes.
5516.
Yes.
5517.
Yes.
5518.
Yes.
5519.
Yes. Thank you.
You're welcome. Have a great day.
Thanks, you too. Gotta be fast. Yeah.
How you doing?
Damn.
Okay. Remember which one? Like I can just go through. Okay.
She can't have her hand up and be voting at the same time. That seems against the rules.
While we're sitting here waiting patiently.
You missed this one. This is SB 451.
Rep Biggins, what school do you teach at?
So I just got a role at Goodwin Magnet Schools.
Oh yeah, good one. What subject?
So I'm a counselor, so I'm the retention
Okay.
counselor. So I'm working with new kids
That-
to the district, trying to get them acclimated, that sort of thing.
Guidance counselor.
Yep.
All right. All right. Good luck. How long you been doing it?
15 years? Something like
Really?
that. Yeah.
This is your first year at Goodwin?
Yeah.
Where were you before?
I was at Odyssey Community School in Manchester for the last 4 years, and then Ailing Middle School for 5, and then I was up in Worcester for a little bit.
Okay. Okay. I'm familiar with Odyssey.
Yeah. Good people over there.
That way, isn't that a K-8 program?
Yep.
That's what I thought. Yeah, they're quiet. You don't hear a lot of noise from them, but they're doing their thing over there.
Yeah.
And you were at Ailing also?
Yep.
Who's the principal when you were there?
Iris was the principal for we had 4 different principals in my.
Oh, really?
It was a struggle.
Yeah.
Matt Geary, the superintendent, was the principal for 1 year. Beth Hayes was the principal for another one. So
I think the person I know that he was gone probably by Dr. Monroe.
yeah, I think he left 2-3 years before I got there.
Okay. Yeah.
So you're Senator. This is SB 194.
There's a crew there, but the
Yeah.
people that have been there for a long time, man, they've seen a lot of principals come and go. It's not a good scenario.
Yeah, I know. That's crazy when you got that much transferring. That's a lot. That's a lot on the district.
Yeah.
Is that the only middle school in Manchester, or is it another one?
There's 2. They have one that's 5-6, and then that one's 7-8.
Oh, okay. That's the 7-8.
Yeah.
This is 5513. Correct. Change that vote. For 5514.
I would like to switch my vote from no to yes.
Okay, confirming a switch for 5514 to a yes. Okay. This one means that it's next. You're all set, sir. Have a great day.
Thank you for being so conscientious. It's not easy.
Thank you. Have a good day. Okay. So, those online, I'm so sorry for the wait. Thank you for being so patient.
No problem.
Senator McCrory,
Yes.
are you the first one in line? Senator, are you there?
I'm here.
I can't hear you.
You can't see me? You can't hear me? I can hear you.
I can hear you.
Tell her I can hear her.
Hold on, sir.
If she can't hear you, I'm assuming she can't hear me either.
Yeah, I know.
Senator McCrory,
Yes.
can you hear me, Senator?
Yes.
I'm not hearing you.
You can't hear me?
Representative Paletta, are you hearing me?
Can you hear me now?
Yes, I can hear you. Can you hear me? Hello?
I can hear both of you fine. It's just, I think Diane and
Yeah,
the room can hear
I
us.
think it's on their end.
Right.
Hey, this is Martha. I'll call Krista McCarthy Vahey and tell her.
Anyone hear me?
We-
You're hearing me, Senator McCrory?
Yes.
But I'm not hearing you. Can you speak, please?
We can't hear you.
I'm not hearing.
Hello?
Yep.
Hi.
Can
Someone-
anyone hear me?
We can all hear you.
Can hear you.
Yes.
I'm not hearing you.
I'm gonna go back on mute because
Okay, let me see if I can. Okay, fine. Okay, I'm not hearing them. Okay. Them are off, you see, it's on. They're hearing me. I did unmute. But then I'm not hearing. Rep Paletta, can you give a thumbs up if you can hear us?
I can hear you speaking, but I know you guys can't hear me.
We can't hear you, Rep Paletta. Okay, so you hear us, but we can't hear you. So because it's the theme of the session, we continue to have technical issues here. So I see you and Rep Biggins and Senator Marks and Senator McCrory. Is anyone else waiting? We're gonna need to get someone to come help with the Zoom issue, which I am not proficient in. And we're gonna make sure that we get back to you guys. So if you wanna just hang on, it may take a few minutes. Okay, thank you for your patience, everyone. Thank you. This is on. So you can't hear anybody, right? You can't hear anybody? Can't hear anybody. They- Hi, can someone speak into the mic? Okay. I'm so sorry. Can someone speak one more time? Can they hear me now?
Testing, testing.
Oh, perfect. There you go. All right.
Oh, you can hear us now.
Yes.
Okay.
Is it working now?
Yeah, I think so. They can hear me.
Okay,
it's
thanks,
working
Senator.
All right. Senator McCrory? Senator McCrory?
Yes.
Okay. All right.
Yes.
For SB 194. SB 194.
Yes. Yes. Can you hear me?
Yes, I can hear you. SB 451.
Anything else?
SB 451.
Yes.
SHB 5322,
Yes.
5510,
That's a yes.
5511,
What's the title of that? What's the title?
hold on, sir. An act concerning the Department of Public Health's recommendations regarding consent orders.
Yes.
5512,
Yes.
5513,
Yes.
5514,
Yes.
5515,
That's a yes.
5516,
Yes.
5517. Yes, you voted on that.
Yes.
sir.
I think I voted on that. I think I voted on the
You
last
voted on
one.
5518 and 5519. You're all set, Senator.
Thank you.
Thank you for your patience.
Diane, I think I missed one.
Okay.
And I think it might just be 12. Drinking water.
Okay.
But I'm not positive on that.
And double checking.
Okay, thank you, Diane.
Representative Biggins, you missed 5517. Rep. Biggins?
Bagans votes yes.
I
Yep.
didn't see you.
Can I vote yes now? Is that-
Yes, I see you now.
Okay.
Thank you. You're all set, Rep. Biggins.
Thank you very much. Have a great day.
You too. Rep. Paletta, can you hear me?
Yes, thank you.
Okay.
I only missed a couple of votes. But I need do you have the numbers of them? Because I don't have the titles in front of me.
I'll do that.
Thank you. Rep. Paletta, you missed HB 5514, which is an act concerning various revisions to the public health statutes. What number was that on the agenda?
On the agenda, that was number 8.
Okay, 8, yes. I'm a yes.
Well,
Thank you.
You also missed 5516, which is number 10. How do you vote on that one?
That one, I'll be a no.
5517, which is number 11 on the,
I'm a no on that.
pardon me?
A no.
5518, which is number 12.
I'm a no on that as well.
5519,
Yes. Thank you.
and you're all set. Thank you so
Thank
much.
you. Have a good night.
You too.
Hello.
I can hear you.
I can hear you. This is public, so let's not be too weird. You don't be too weird. I'll be weird. I can be weird. I got elected to be weird. My constituency expects me to be weird.
Okay, Rapelian.
Okay.
So you have SB 194.
Yes.
Vote on that.
Hi, Senator.
SB 451.
Yes.
HB 5322.
Yes.
I just gotta get my background on teaching all this. Yeah, and she's surprised her. But I didn't mean to.
HB 5515.
Yes. I'm gonna have one question about one other bill that I had said yes to before we end. I just want to follow up with something.
5516.
Yes.
5517.
Yes.
5518.
Yes.
5519.
Yes.
Do you remember which vote you wanna look back at?
There was the bill that D'Amico voted no on. This was the care at home bill, correct? I'm sorry, Martha.
You mean HB 5512?
Is that what he-
Recommendations, real estate, that's the one?
Is that the only one he voted no on?
Well, I don't know. Who you said voted no on there?
D'Amico, Mike D'Amico.
There is, it seems as if there was a change of vote for the meeting, so,
Okay, I'll come back to you. We're good.
yeah, but you didn't vote on that one.
Oh, I didn't vote on that one? Yes.
Okay.
Then.
Senator Ma, please.
Are we all set, Diane?
Hold a second, I'm just double checking.
Okay,
I'm going
okay.
to look for another vote to just
Okay.
make sure that you. That's Rep. Elliott. Have a good day.
Thank you.
Senator Marks? Senator Marks? You can't hear me? Senator Marks, I am unable to hear you. Representative Lucas?
Oh, I can hear you now.
I can't hear you.
Can y'all hear me?
I can hear you, yes.
Oh, there
Yes.
she goes.
There you go. Now we can hear you.
Okay, I've been waiting a while here.
Senator Marks?
Yep,
Okay, for SB 194, how do you vote?
Marks votes yes.
SB 451,
Marks votes yes.
HB 5322,
Marks votes yes.
S 5510,
Marks votes yes.
5511,
Marks votes yes.
5512,
Marks votes yes.
5513,
Marks votes yes.
5514,
Marks votes yes.
5515.
Marks votes yes.
You voted on these already. Okay, you're all set, Senator.
Thank you.
You're welcome. Senator Zupkus?
Well, I'm Rep. Zupkus, Senator Summers.
All right. Yeah, I just said it, so I think you were in before she came in.
That's fine.
Okay.
All right.
I don't have the numbers with me, so I just have it listed as 1, 2, 3.
Oh, okay.
I didn't vote at all.
Oh.
Heather, did you vote at all?
I did not. So if you want to
Oh,
pull
we could do it together.
together.
Okay, that sounds great. All
Been an
right, so for
appropriation.
number 1, which is SB 194,
That's cardiac screening. We're right at the bottom too, S and Z, I think.
Yeah.
not really on my sheet.
Oh, I'm at
They
the
always,
Okay,
Right.
oh, you're at the top. They
Right.
always save the best for last.
okay, so how do you vote, Senator Summers?
I'm a yes.
Yes, okay, Senator. You too?
I'm a yes also.
Okay. For SB 451, which is number 2. how do
I'm
you
a yes on that.
Senator Summers? Yes. Senator, Representative Zupkus?
I'm a no.
HB 5322, which is number 3, how do you vote? Senator
I'm a yes. Heather Summers is a yes.
And I'm a yes.
5510, which is number 4, how do you vote, Senator Summers?
Yes.
Representative Zupkus?
Yes.
5511, which is number 5, how do you vote, Senator Summers?
Summers votes yes.
Rep. Zupkus?
And I'm a yes.
Five 5512,
Summers is yes.
okay,
I'm a yes.
And I'm a yes.
okay. HB 5513, Senator Summers, how do you vote?
Summers votes no.
And Zupkus is a no.
Okay. HB 5514,
Summers is a no.
Rep. Zupkus.
I'm a no.
HB 5515, Senator Summers, how do you vote?
Yes.
Rep. Zupkus.
Yes.
5516,
No.
which is number 10. Okay.
And Zupkus is a no.
Okay, have that recorded. Thank you. 5517,
Summers is a no.
And Zupkus is a no.
5518,
Summers is a no.
And Zupkus is a no. You can tell where the Republicans are on and the Democrats are on. You can't say that, Diane, but I can.
all right, so 5519,
Yes for me.
And a yes for me.
and you both are all set. Thank you so much for your patience.
Thank you.
Thank you. Take care. Bye-bye.
Bye, Leslie.
Bye.
Bye-bye. Senator Slack, good afternoon.
Hey, good afternoon. How are you?
I'm very well, thank you. All right,
Good.
so we're gonna look at the bills that you have to vote on today.
Yeah.
The first one is SB 194, which is number
Yeah.
one on the list on the agenda. How do you vote?
Yes. Yep.
SB 451,
Yes.
HB 5322,
Yes.
— 5510,
Yes.
5511,
Yes.
5512,
Yes.
5514,
Yes.
5515,
Yes.
5516,
Yes.
5517,
Yep.
5518,
Yes.
5519.
Yes.
I think you're all set, senators.
Okay. Thank you very much. Have a good day.
You too. Have a good day.
You too. Bye-bye.
Rep. Gilchrist?
Yes.
Yeah. You missed a few.
Yes, I think I only voted on the first three. I left after the endometriosis vote.
Oh, okay. All right. So okay, so 5510, how do you vote?
Yes.
— 5511,
Yes.
Yeah. Okay.
— 5512,
Yes.
I can't hear. What happened?
5513,
Yes.
5514,
Yes.
5515,
Yes.
5516,
Yes.
5517,
Yes.
5518,
Yes. Sorry.
no problem. 5519,
Yes. It's a man with an M. It might be the neighbor.
Reverend First, seems as if you are all set.
Thank you. Have a great day.
You too.
Good to see you, Senator.
Good to see you too. Hello.
1 minute, Senator.
Okay.
Thank you. Senator Roman, good afternoon, sir.
Good afternoon. How are you?
I'm very well, thank you.
Okay. Anything supported by both chairs? Yes, yes, yes. Make easy for you.
Okay, Senator. I think I might still need to go through them, sir.
Sure, absolutely. Let's do it.
Okay. All right. So, for SB 194,
Yes.
SB 451,
Yes.
HB 5322,
Yes.
5510,
Yes.
5511,
Yes.
5512,
Yes.
5513,
Yes.
5514,
Yes.
5515,
Yes.
5516,
Yes.
5517,
Yes.
5518,
Yes.
5519.
Yes.
You're all set, Senator.
Awesome. Thank you so much.
You're welcome. Have a wonderful evening.
Don't work too hard.
Hello. Hi.
Hold a second, please. Martinez, good afternoon. Can you hear
Hello.
me well?
Yes.
Okay, good. All right, so we're starting with the first one, SB 194. How do you vote?
This meeting is being recorded and live streamed.
Yes, this is
Okay,
just a
sorry.
continuation.
Yep.
We've held the votes.
Yeah, no, absolutely. It's fine. It's fine. Sorry, it just popped up on my screen. Okay, I'm sorry. Go ahead.
All right, so this is SB 194, number
Yes.
1 on your agenda. How do you
Yes.
vote? SB 451.
Yes.
HB 5322.
Yes.
Five 5510.
No.
5511. Do you want me? 5511 is an act concerning the Department of Public Health recommendations regarding consent orders. She fell off. Okay. You got
Hello, I'm sorry.
got bumped?
I'm sorry, I got bumped. And I'm sorry, House Bill 5510. I am voting yes.
Okay, hold on, let me just double check. Okay. Okay, so 5511, how do you vote?
No.
5512.
Yes.
5513.
Yes.
5514.
No.
5515.
Yes.
5516.
Yes.
5517.
Yes.
5518.
Yes.
5519.
Yes.
I think you're all set, Rick Martinez.
All right. Thank you.
You're welcome. Have a great day.
You too. Bye-bye.
Hello. Do you need me to change my name on screen?
Necessary.
Okay.
Hi, Senator, how are you?
I'm good, thank you. How are you?
I'm very well. Okay. All right, so we're starting with the first one on the agenda. That's SB 194. How do you vote?
Senator Hockadell votes yes.
We have SB 451,
Senator Hockadell votes yes.
HB 5322,
Senator Hockadell votes yes.
5510,
Senator Hockadell votes yes.
5511,
Senator Hockadell votes yes.
5512,
Senator Hockadell votes yes.
5513,
Senator Hockadell votes yes.
5514,
Senator Hockadell votes yes.
5515,
Senator Hockadell votes yes.
5516,
Senator Hockadell votes yes. I just need a replay of all my play.
5517,
Senator Hockadell votes yes.
5518,
Senator Hockadell votes yes.
5519.
Senator Hockadell votes yes. How are they going to get all these on the floor?
Thank you so much.
Thank you. Have a great day.
evening.
Bye-bye.
Hello.
Parker, how you doing? How sweet that.
Diane, can you hear me?
Hi, can you hear
Oh,
me?
yes, I can hear you now. How you doing?
Cool. All right, so number one on the agenda, SB 194.
Yes.
451,
Yes.
5322,
Yes.
5510,
Yes.
5511,
Yes.
5512,
Yes.
5513,
Yes.
5514,
Yes.
5515,
Yes.
5516,
Yes.
5517,
Yes.
5518,
Yes.
5519.
Yes.
You're all set.
Big,
Representative Parker,
big agenda today. Thanks for getting through it all.
thank
Bye.
you so much.
See you later.
Have a great day.
You too.
Bye, little one.
Rosie, say bye. Thank you. Bye. See you, Diane. Thank you.
thought I got them all. I must have been when I was just walking from downstairs upstairs on this one.
All right, so,
Should just be one, I think.
yes, it's just one. Let me.
And I don't even care what it is. Yes.
I know.
What's that?
We're on, sir.
This may be your last chance.
So this is HB 5514.
Oh, I'm sure I know that number.
Okay, so how do you vote?
I vote
sir?
yes.
Thank you.
Thank you.
Well said.
Appreciate it.
Votes are officially closed.